I'm Dr. Cyrus Thomas. My guest is Janara Iman. She is a clinical nutritionist and is going to be helping to bring this topic out so that you can understand it. Give me a question.
Hello. I would like to know why you would use science-based nutrition over some other kind of nutritional evaluation.
Well, science-based nutrition means that it's being done according to blood analysis, urine analysis, and hair analysis combined. You know, most blood test companies base their normal ranges on the last 100 people who had that test done. Those people are sick.
Right.
It's not a very good range to rely on. And so other ranges have been discovered by a large group of chiropractic physicians who are doing all of their nutrition based on blood analysis. And when I say blood analysis, it's always including urine and hair as well. So their normal ranges have been changed.
Right.
They never do small profiles either. They do large profiles. So they catch things that other doctors don't catch.
Right. So in other words, they're looking for a different marker range.
Yeah, they're looking for a different range of normal. Now they have three ranges. There's a normal range, then there's one of concern, and there's one that's a code blue. And when a person gets a range that's so far out that it's a code blue, you're actually saving that person's life when you put them on a nutritional program to bring those numbers back to normal.
Now you're talking about a code blue in regards to science-based nutrition, correct?
Yeah, for example, if we look at these, if we look at this blood test, this is the patient's last blood test. If we can bring on camera 4 maybe and take a look at this. We've got yellow, blue, and red here for their blood tests. These were their previous blood tests over here. So we're following this person every month or two with a new blood test to see what kind of results we can get. And you can see that at present, there's only a few yellows here, one red. Okay, they've made a remarkable improvement. And I have some case histories that I want to talk about here today too.
They did. They've got a lot less blue.
So for example, on the hair analysis, we see an improvement there too, where they had blues or code blues over here, and as time went by, things balanced out more. So for example, we have a person who had Alzheimer's. In 4 months, their memory had improved, their anxiety and stressors was reduced, they were able to concentrate, their sense of humor had returned, they were no longer depressed, and they were more animated. Those are good signs of health, don't you think?
I would think so, and especially if you're basing those on ranges that are optimal ranges of normal.
Right.
Because when you were talking about code blue, I was thinking if you're basing these test results on the low range of normal blood testing, which are from people that are sick, their code blue could be hospital.
Right.
Versus them walking into the door.
Right, and you can't always base how you're doing health-wise on how you feel.
Right.
Because we all have heard the story about John. He was feeling great and he was dead in a day. Well, John can be feeling great, come in, and he's got tens of reds and blues in his blood and urine and hair analysis. Another patient with breast cancer, in just 2 weeks, the tumor, the tumor marker 2729, CA 2729, had dropped 106.9 points. Patient refused chemo and radiation therapy due to the outstanding results she had gotten before she was to go to chemo and radiation. Her blood pressure showed improvement, and an update of her CA 2729 eventually dropped to 19.5.
Oh, fabulous.
Which is a very healthy range.
So let me ask you this. What if you come in just for a normal checkup? How would you check for inflammation markers if someone says, hey, I feel fine, I'm just coming in for my regular yearly checkup?
Yeah. When there's inflammation, of course, it's usually caused to too many carbohydrates in the diet, causing inflammation all over the diet. We're going to see that in an ESR, erythrocyte sedimentation rate. We're going to see it in a C-reactive protein.
Right.
They're going to be here. There's no way you're going to miss that. But the person who's feeling a lot of chronic fatigue is going to have usually some heavy metal toxicity.
Right.
That's going to show up normally in the hair. Now, strangely enough, in autism and other autoimmune diseases, ADD, I could refer to my list here, they don't show high levels in the hair. They're so sick, they can't even get rid of the heavy metals through the hair.
Yeah.
So when you don't see them there, and you should, you're dealing with somebody
Very
that's pretty severely sick. Now, you can do a DMSA challenge where they consume a substance that makes heavy metals leach out of the urine. Another one can be done to make it leach out of the stool. But you do the challenge, and you can see if they've got it, because if they've got it, that'll make it come out of the urine. You can't do that with really sick people, though. You don't want to challenge the kidneys when they're feeling really bad. So you have to do other things first. Okay. But the first thing you want to do is balance the blood chemistry. The body starts healing itself as soon as you do that. A person came in with Crohn's disease, and within 3 months, their digestion was under control. They had no nausea. Fingernails were healthy and strong. Dermatitis was gone, and they had increased energy. Diabetes. Some 40% of the population is either pre-diabetic or diabetic, and they don't know it. So we don't just test for glucose in the blood, for sugar. We also test with what's called and hemoglobin C1, and it shows you how much sugar is on the red blood cell. It turns out to be a much more sensitive marker for especially pre-diabetics. When the person gets their blood, their hair, and their urine done, all of this data is brought to a centralized computer that looks at the medications that they're taking, generates a report that makes suggestions in not only supplementation to take, but dietary changes to make, exercise programs to go on, tells them the danger of the pharmaceuticals that they're on and any interactions that might be taking place with the pharmaceuticals they're taking. Eventually, the patient will take themselves off the medication. We don't take anybody off their pharmaceuticals or even their bioidentical hormones. They will start to feel better and take themselves off of it.
So that's a sure indication of the body healing itself. Once you're giving it the right tools and you know what those right tools are, and you've looked at all the indicating markers for what those could possibly be, and the program's all set out. The person begins the program, they begin to incorporate the nutrition, the lifestyle, and can continue on their medications until pretty soon they're starting to feel better, and they say, "Hey, doctor, I'm wondering if you could check me. I don't need this statin drug anymore, perhaps."
One of the worst drugs there is the statin drug, absolutely, and they'll take themselves off it in time. You don't have to recommend that they do it. And then, of course, a supplement program is designed, number of pills per day. Okay.
That's all done for you by the computer.
That's all done but we don't want to say a computer figured this out. This computer was written by hundreds and hundreds of doctors who are participating in this program.
Okay.
So this is the accumulated knowledge and wisdom of many practitioners, and really in this country right now, chiropractors who are doing a lot of nutrition are on the cutting edge of health care, because they're doing it better. They're doing it more safely. They're using ranges that make sense, that really tell us how a person is doing or not doing.
So how would you look at cholesterol in a situation like this?
Cholesterol and triglycerides should be about 200, but cholesterol is a very slippery substance.
I totally
understand. One of my favorite nutritionists.
I just wanted to get that in there.
One of my favorite nutritionists wants his cholesterol to be at 300.
I know.
So we can't believe everything we've heard about cholesterol.
Well,
there's a lot of hype around it, and the hype is based on selling statin drugs.
Yeah, I understand that, because even in LDL, there's actually a good LDL and a not so good LDL.
The low density lipoprotein.
Exactly. And one type of low density lipoprotein actually helps you make hormones, So we don't want to
'Cause
give
you need
anybody.
fats to make hormones.
You need fats to make hormones. So we've got these. Cholesterol is nature's Band-Aid, and it just depends on how it's acting in the body. So once again, we come back to how can we support the body in how we're testing. So
Yep.
tell me a little bit more about why this is different when somebody comes to you, a patient walks in your door, and you're giving them, blood analysis and hair analysis. Why is that different than if they go to Dr. So-and-so and say, I want a blood analysis and a hair analysis?
Well, they usually if they go to their medical doctor instead of a chiropractic doctor, the medical doctor is not going to do hair.
Correct.
And he's going to order the test. The test is going to be sent to him, and he's going to make his or her interpretation of that test.
Based on
It's
those
not
other
going to go
normal
through a
ranges.
system that
Right.
has hundreds of nutritionists, doctor
Right,
nutritionists working on people, accumulating their wisdom. This is all there for them.
Well, I love the idea that it's based on optimal health.
Mm-hmm.
The normal range is optimal health normal range. So that's quite different already from the average blood test
Right.
results that are going to be compared to
And
a doctor's office.
so for example, if calcium or potassium or zinc, manganese, vanadium, molybdenum, any of these substances are low, we're going to bring them back up. If they're high, we're going to bring them down. And what to use to do that is already known.
So how
Okay.
easy is this to use?
This is very easy to use. The patient compliance is important. If they're only taking the pills and not making any dietary change, it goes much slower. If they cooperate and make dietary changes, and we don't put anybody on diets, by the way, we just teach them how to eat well.
Yeah,
Okay?
wonderful. Yeah.
Right. We show them how
Good.
to lose weight by eating often during the day and not getting their leptins out of control and always being in a state of hunger and all that. There's many cases that are fabulous. Diabetes and high blood pressure in 3 months, triglycerides down to 129, increased energy off all of their 6 medications. Glucose level dropped from 274 to 120.
Oh my
This is in
goodness.
3 months.
This is amazing.
Thyroid showing improvement, and they lost 30 pounds. We don't look for rapid weight loss, by the way. 2 pounds a month for 3 years is a good goal for somebody who's carrying too much.
That's very interesting.
Right.
Yeah.
Because it took a while to put it on. So
Of course it did.
you're gentle to the body, you're nice to the body, you're giving the body all that it needs, and most importantly, you're monitoring this patient. Every 1, 2, or 3 months, you're redoing certain tests. You're looking to see if what you did is working. Now, as far as which supplements to take goes, sometimes a patient will come in and they'll say, I'm taking all the supplements because, I already had a lot of them
Yeah.
before he came to you, so, I didn't buy any new ones. And you say, well, they're not working. I don't have anything bad to say about that company, but I just know that what you're doing is not working. Let's try a different company. And a patient can use a company of their choice if they have a specific company they like, Metagenics or Douglas Labs or whatever. There is no preference to company by the doctor who uses this method. However, if they say to me, choose the company you think is best, that's what I'll do.
Okay.
I'll
I
choose
like
my
that.
favorite.
What about cost? As far as nutrition,
The
as far as
patient orders the supplements themselves.
so
And
they
they're
go
shipped
directly.
to the patient. The doctor doesn't sell the supplements to the
Oh,
patient.
that's nice.
Yeah,
So they can go through the list of nutrients that
they were suggested,
and they can.
and they shouldn't change that list, by the way, because there's so much wisdom in that list.
That makes sense.
Yeah.
I mean, we're talking about science-based nutrition here,
Right.
and we've got.
If you start fooling around with it, liver cancer, lung cancer, menopause, and insomnia. We're treating Crohn's disease, anxiety, ankylosing spondylosis. Story after story of not only a
Yeah.
patient saying they're feeling better, but objective, documented proof that they are better.
That they are better. And so the cost of the blood tests, are they different than if, since
Well,
you're talking about a
we're
package?
doing an extensive profile.
Yeah.
This would cost their insurance company some $400 to get all of these tests done. We get them done for a lot less than that. So, because so many doctors are using this system, They've been able to make group pricings, and so it's better.
So it's more
Also,
economical.
when you don't go through your insurance company, none of this information goes to your insurance company to be used against you in the future.
Well, now with paperless files, I think patient files are going on the internet. I know
everything's being
we're doing a
digitized.
training in our office, and it's all going to be paperless files, so anybody can access it at some point. Now, there's security things in place, but it's nice to know that you have privacy over your own records and you have control over your own records.
Right. Remember, too, that we're not treating the disease.
Correct.
We're remaining holistic in this. We're treating a condition. Because as soon as we start to focus on a disease, we start to look for a silver bullet substance.
Right.
You need bee pollen. Bee pollen has cured so many people. And every 6 months we're jumping out, we're excited about a new silver bullet. This is not like that.
Then
this
you're
is
saying
very basic, very foundational. Bottom line, we have to get these numbers in order, or the rest of you cannot get well. You cannot get yourself well.
So if I have diabetes and you have diabetes, I might have a different program than you because my core needs are different than yours.
We're going to be quite different.
Yeah, that's
There'll be
wonderful.
some similarities because we're still
Well,
talking
right.
about a pancreas and insulin, etc. But no, there will be it will be individualized to your condition.
And I might have a heart condition because of my diabetes and you may not. Just depending on the individuality. So I like that. I like that. Yeah, that's very
And you know, one
different.
organ oftentimes draws energy from another. The acupuncturists know
Right.
this well. So oftentimes we're seeing, people with colon problems have lung problems, and
Correct.
the adrenals are connected to the heart and all
And the
that.
kidneys.
Those tend to
Yeah.
balance out here. So if a person comes in with heart symptoms and the doctor orders blood tests for the heart, and things look kind of okay,
Yeah.
or things look bad, person starts taking all of this supplementation or medication, pharmaceuticals for the heart. But if you did the complete blood profile and you see that the kidneys are exhausted, the adrenal glands are exhausted, you treat the adrenals and the heart gets better.
The kidneys can be exhausted too if it's
Yeah.
but it's usually adrenals we're talking about.
Yeah,
Right.
they support the heart in an odd way too. But they do, and we know that if we support the adrenals, the heart gets better. That would not have been done without a complete profile.
That's right. So you're looking at a holistic approach here.
Very holistic. And when we look at hair, we're looking at minerals in the body, really, and what levels are they at. We're also looking at poisons like arsenic, and we're looking at heavy metals like mercury and aluminum, which is not that heavy a metal, nickel, silver, tin, titanium, etc. These can be in outrageously high amounts, which prevents a cure. A woman came into a nutritionist, put her on the supplementation. The results weren't coming forward, and she was African American. The hair straightener that she was using was so poisonous and going into the blood.
I've seen that.
That it prevented her from getting well.
And
So they stopped
mercury,
that, and this nutritional program took off.
Yeah, I believe that.
Yeah.
And it's interesting how it comes out in the hair because it's the body's way of releasing it, or it's one of the body's way of releasing it.
As long as you're healthy enough to be able to release
Like
it.
you were
Remember,
saying.
I was saying, if you're really
That's right.
sick, you can't even get it out of your hair.
Right. And so if I was to come and say I would like to be tested according to science-based nutrition, would I automatically get...
You're sent to LabCorp with a requisition form.
Okay.
LabCorp draws the blood. They do the analysis. They send the results to this centralized computer.
Gotcha.
You take home a hair testing kit. Shows you how to cut a little bit of hair off. You mail it into doctor's data. They analyze it, send the results to the same computer.
So everything's going to central.
We do the urine analysis in the office.
Okay.
Sometimes we'll order extra tests like a DMSA push
Right, okay.
to see if there really are heavy metals there, or there are other studies we do too. It can be in addition. It takes about 2 weeks. Everything comes back, and we sit down, and you're shown what the problem is. Now, subject of muscle testing. Most of the docs who use this method do not muscle test. They rely on the objective proof of the examination. Okay? Some people
Understood.
want muscle testing, though, and demand it, and feel that the body will tell them what they need and what they don't need. This is really not for people who demand muscle testing. Person needs to be muscle tested, we'll muscle test them and not use this system.
Okay, I understand. And sometimes in muscle testing, there's sensitivities on certain days where a product or a supplement might be testing yes for a certain period of time and then testing no. So
Well, the muscle testing could be true and accurate, okay?
Yes.
But it's not going to tell you how 52 different substances are doing over time. Because
Right.
you're not going to do 52 muscle tests for all these substances. You're going to come up with a few good things that you
Right.
think are good for the person.
Well, from what I understand, you're also getting a diet program as well as a nutritional program. You're getting exercise suggestions. You're getting a profile.
You're
that's
also getting a look at
individualized.
your pharmaceuticals and seeing if they interact with each other in a way that you don't want them to.
Oh, and that's really good.
Yeah.
Um,
And then you go on the program for a month or two, and then you get objective comparison
yeah.
to see if the program was well chosen.
And from what you're saying here, you've shown us results. Are they typical? Most people improve immediately unless there's a condition like you were saying, there are metals in the hair.
You can figure on 2 to 3 months to show enough improvement to where the person is feeling better enough to be completely enthusiastic about this.
Oh, I like that. And so they're going to go in this program, they come in, and they've got this nice little packet, and they know what they're supposed to take and why they're supposed to take it, and they go in the program. How soon will they be tested again? You said 2 or 3 months.
It depends
How long?
It depends on the severity, it depends on the chronicity,
Yeah.
depends whether they're getting chemo and radiation at the same time.
Got you.
All of these things change what you're going to do. It also depends a little bit on their finances, because you don't want to strap them. You know, they could be doing anywhere from $50 to $150 a month in supplements that they order. And when they get low on them, they just reorder again from their home.
And they do that on their own.
They do that on their own. Now, if they want to get particular supplements, and some supplement companies will only sell directly to doctors or practitioners of nutrition, then they would have to get them through us.
Okay.
So it all depends on what they want to do.
And so then the company sends the supplements to you and they come and pick it up?
No, company sends them to them. However, if
Do
they
you
only want
order it? No, wait, I'm confused.
No, if they want products for
That only
which the
goes through-
company will only sell to me, then they have to come get them from me.
That's what I'm asking you.
Yeah, but that's
Okay.
the company's prerogative, and it's not our decision.
Okay. So basically, this kind of puts the patient in control of their own nutrition.
They're
and
very
their own
much in
healing.
control. And you know, if they cheat and lie, because patients do that.
Right.
They might come in and say, "Oh yeah, I'm doing everything that's on the, I'm doing everything that's on the, the 30-page suggestion here. I'm doing everything you said, doc." And you look at the results and you say, "No, you're not." And they go, "Okay, I was taking the pills in the hopes that would do it because I didn't want to have to make any dietary changes." I said, "Well, no, not good enough.
Right.
You have to make dietary changes too. You have to go towards a lower carbohydrate diet, quality fats, etc."
Yeah. For the fat-phobic person, that's hard, because I deal with that all the time. There's people that just don't understand the role of fats because we have so many bad
They
fats.
think fats make fat.
Exactly. Fats don't make fats, but certain fats do, like trans fatty acids, your Criscos and your refried vegetable oils from fast food restaurants. They do make fat because the body can't utilize that, so it stores it away as a little toxin. And so it's really important that they understand the difference. Now,
And so in obesity, we're not really treating obesity initially. We're treating their condition, making them healthy and obese but healthy.
Sure.
And then that healthiness will help them decrease their obesity much more easily over time if they get healthy first.
Sure.
So if people want to come and see you to do nutrition with you, your phone number is
415-847-5502.
And if they want to come to me, my number is 415-847-5020.
Very similar.
close numbers. Okay, so we've done a good job talking about this.
This is exciting.
It is very exciting. Combining hair with urine with blood.
And having it in all one package, and then supporting the body so that it heals itself.
And it's
completely exciting.
It's scientific, you know?
Yeah, it's the missing link.
Right. People these days don't want to trust their doctor.
Right.
They don't want their doctor to sit back and go, you know, I think that really what you need to do is maybe a little this and maybe a little that. They go, well, doc, this is your opinion. How do we know? What people want today is the urine test said you have this problem, here's how we correct it. The blood test says you have this problem, here's how we... The hair analysis shows you have all these heavy metals and low minerals. Deal with this problem. The x-ray shows that you have a curvature in your spine, you have decreased disc height, you have spondylolisthesis, all kinds of things. Then they say, yes, you're right, I do have that.
Exactly.
Now, I'm still not very happy about taking x-rays. However, if a person has already had x-rays taken, I really do want to look at them. But I'm hesitant to order x-rays because I just don't think we know enough about what radiation is really doing to the body.
We're learning
We're just
more.
finding out now what electromagnetic fields do to the body.
We are.
And that's so much lighter in intensity than the x-ray used in... by the way, a note on CAT scans.
Okay.
Sometimes they're equal to 500 chest x-rays.
Oh my gosh.
A series, a CAT scan series.
500
chest x-rays. Don't get a CAT scan, get an MRI. The doctor will say, but the resolution isn't as clear. You say, I realize that, I'm sorry, but that's all I'm willing to do is an MRI. I don't want the x-ray, and you'll have to deal with a lower resolution and tell me whatever you can from it.
And they're still pretty good.
Also needle biopsy.
Oh, yes.
Don't get a needle biopsy. As you retract the needle from the cancer, you spread the cancer throughout the body.
Right, right. This is not a good thing.
No.
And it's more dangerous, actually, in the long run.
Yeah.
So
another note about cancer, we have 30 seconds left here, is that the tumor is not the cancer. The tumor is just the concentration of the cancer. And when it's removed, the person still has cancer. They still need to do these programs to get healthy.
Because they didn't get to the core. The tumor was the body's encapsulation of the toxin that created the tumor.
One more time, your phone number?
415-847-5502.
And I'm 415-847-5020. Thank you for talking about science-based nutrition.
You bet. It's exciting.
Nutrition through blood analysis.
I like it.
Okay.
Thank you.
Thanks for being on a program.